Oh, hello to Dr. Whisper's dermatologist. I'm so sorry. Yeah, I can really see that. Let me see if she has an opening for you. It's a walk-in, right? Will you say it's an emergency? She does take emergencies and walk-ins. I just need to know if she has an opening for you. Let me see. She is with a patient right now, but she should be done in about 5 minutes or so, okay? Just need you to sign you in. May I have your name, please? Oh, yes, I'm sorry. I do see how uncomfortable it is. I hope that I could do something to ease the discomfort. Sadly, I can't, but I'm gonna try to speed up the process so Dr. Whispers can see you right away, okay? Very well, so as I can see, you're coming for an issue in your skin, as could be a rash. Yeah, very good. Let me see. Yeah, I'm paging Dr. Whispers right now that we have an emergency for this. I can also see some swelling. Do you you have an allergic reaction? Well, that will be discussed with Dr. Whispers. Very good. Do you have any history of past allergies? Well, it could be foods, or it could be maybe soaps, stuff like that. Yeah, anything that you can recall. At any moment right now, are you going through pain? Okay, I'm so sorry. Don't worry. Dr. Whispers has already been paid. She already gave me green light to let you in. She just needs to finish with the patient she is right now. It won't take long. Very good. When did this started? Oh, just this morning. You were on your way to work and just noticed it. Okay. And you come here. Oh, okay. Google recommended you with us. The closest one. Oh, you're in luck. Sometimes dermatologist appointments and emergencies can be very difficult to attain, but Dr. Whispers is always open for these cases. Very well. Let me see if I can give you something for relief. Dr. Whispers paged me that I can give you some tissues. These are medicated tissues for this type of situations. You can just put it in your face like this, so it covers it up and it freshens up. It's not a medicine or anything. It's just to freshen up, to ease some of the discomfort, okay? Here you go. There is 3 little towels there. Use as many as you want. She's almost ready for you. Very good. Do you have any insurance? You have a card, thank you. Feels better? I'm glad. Yeah, it helps a little bit. Yeah, try to press it on a little bit stronger. It's gonna help a little bit more. Okay, here's your card, thank you. Okay, everything's ready for you. Dr. Whispers has finished with the client and the patient right now. 1 second. Ready? Okay. Same time next week. Very good. Yeah, we will call you. Thank you. Very good. So Dr. Whisper is ready for you. Just go to the next door right here. Yes, go ahead. Hello. How are you today? Okay. You're having some problems? Okay, you think you have a rash. In what area? Your face. Oh, you're wearing makeup at the moment. Though it's very important not to wear anything on your face when you believe you have a rash, so let's remove that first before we continue. When did this rash start? Okay, now a long time ago. How do you feel? Is it painful, burning sensation, stinging? You don't feel any discomfort? Only tenderness when you touch it. Okay, what is the area where it's located? Okay, your eyes on the sides. Yeah, I can actually notice some of it. Let me just put your hair like this so it doesn't get in the way. Okay, now for future references, it's very important not to wear anything on your face when you believe or you see a rash in your face. Okay, let's just start by taking it off. I'm gonna be very gentle. I don't want to cause any more damage to the area. Do you feel pain? Just tenderness. Okay. Okay, I see it now. Wow. It's very red, actually. Quite swollen. And in both areas. Okay. So you're telling me that it was not long ago when it appeared. When it started showing, was it small or it appeared suddenly on these sides? Started like a tiny bump and then it started growing? Did you know that it stopped or? Okay. Have you applied anything to the areas? And it didn't work. Okay. Well, just by looking at it, I can't really identify it. So we might need to take a biopsy of the area. Okay, for this it can be a little bit painful, but don't worry. Don't worry. It's not going to hurt you. I'm going to apply a numbing solution, lidocaine, to the area with a needle. Don't worry, the needle is extremely small. You're barely gonna feel it. This is just to numb the area because we need to scrap it and take it to the lab, okay? So have you done anything different in the past week or 2 weeks that might have contributed to the rash? Maybe you went camping, to the beach, or took a trip, or got a different skincare products, shampoos, soaps, anything different out of the ordinary of what you regularly use? Now do you know? Okay. Any pets? Maybe in your home you got a new pet, or with neighbors, friends that you touch or they touch you? Okay, very well. Let's just start by doing the biopsy. Don't worry, it's not gonna hurt. Let me just cut them both here. Some alcohol. There we go. Good. Are you gonna feel a little pinch in the area? There we go. Good. Barely feel it, huh? This is gonna numb completely the whole area. There we go. Get a new one. At the moment, do you feel anything? Just a tenderness to the touch? But never felt pain or burning sensation? Okay. There we go. Good. There we go. Excellent. Only takes a couple of minutes to start working. Let's prepare your biopsy kit here. Now I'm going to be scraping the area to get some of the cells in the rash so we can send it to the lab. Normally takes around 48 hours to get the results. Until we know exactly what it is, because I cannot determine it just by looking at it. I'm going to do a close-up inspection, but I want to do first the biopsy, okay? There we go. Very well. Let's start by doing the touching sensation test. I'm going to touch you with this. Let me know if you can feel it, okay? Can you feel this? This? Oh, good. Let's go again. Can you feel this? Good. This? Good. This. Excellent. Okay. Let's do the biopsy. I'm going to be scrubbing the area with this. You're not going to feel absolutely anything, okay? Here we go. Good. You're doing great. Excellent. Let's put this in a container now. Good. Now let's go with the other area. Okay, you ready? Here we go. There's a little bit of bleeding here. Shouldn't happen. Good. There we go. Let me just label it for the lab. Okay, I have your name here in the computer. And your insurance number too. Good. Now let's start with the inspection. Okay. Yeah, focusing more on this one, that it bled a little bit. There we go. There seems to be something inside the rash, almost like dirt. Do you normally exfoliate your skin? What type of products do you normally use? Okay. Can probably be that. There's definitely something inside the rash that maybe got caught in it. Okay, good. I have a suspicion of what could it be, but without their lab results, cannot be 100% sure. Do it like this. Very well. Okay, what I have found while I was moving the area is that there are some type of sand or dust encrusting the area. It could be remnants of an exfoliation solution or cream or whatever product that you use there that might have triggered this rash, especially in the area. I don't know what is underneath unless we heal it completely, but I'm pretty sure that it's an overreaction to the components of these exfoliations that you have been doing. It feels quite tender and swollen. So what I'm gonna do now is try to drain it and see what comes out of it. Okay, let's prepare a solution for that. This is gonna help with it, the process. Now think of it like a balloon. It's not that big, but it's definitely like a cocoon. There's something inside the rash that wants to get out. So your skin, what it created is this protective layer to try to protect your skin from this alien object on your skin. And what it did is create more problems. Sometimes the body gets a little bit confused with what is going on and tries to do the best it can to help it, but sometimes it needs an external help. There we go. Let's do the same here. Like so. Excellent. Let's leave it there for a couple of minutes. Okay, now let me just check in the system here. I'm pretty sure that I've seen a case like yours. Let's see what we use on them. Cinelar. Okay, we use Cinelar on them. Good. It's pretty rare that this happen actually, so you're one in almost 200,000 cases that this could happen. Okay, it should be ready. Let's start the process here. I'll try to open the little balloon in there. Don't worry, it's not gonna hurt. You're not gonna feel absolutely anything. Okay. There we go. Yes. There's definitely something in there. Very good. Okay. Yeah, it's definitely exfoliation because of this. It's the same product that you have been using for, okay, so it's nothing new. Yeah, this just seems to be an overreaction of your body. Maybe you had a little cut in the area, micro cut that you didn't notice, or a scratch or something, and you went inside and your skin overreacted to it. And since it didn't know what it was, it just created the rash and this protective layer. There we go. I'm sure it's going to be the same on the other side. There we go. Good. Yeah, definitely the same, which is good news because we know now what is going on. I don't think that we even have to send a biopsy, but I'm just gonna send it to make 100% sure, okay? That way it's in your insurance. No payment extras for that. Very funny how the body works to it. Okay. Now let's give your body a boost to heal the area and know that this is not something that is in to harm us completely and destroy our face. So we're gonna drain it completely and then give it a topical cream to help it heal. Okay? The process is super simple. Let's start with applying this. Like so. This aloe vera is gonna help soothe the area. Like that. Very good. Leave it for a bit. And then all we have to do is squeeze and clean it. Now you're gonna feel a tenderness still for a couple of days, but after that it's gonna be back to normal. It's gonna heal completely. It's not gonna leave a mark or scar or anything, okay? Let's apply this like that. Not too much. Okay. There we go. You have drained it completely. Now we are giving signals to your body, your face, that this is safe, nothing's bad. There we go. And leave it dry. Now I'm gonna give you a prescription for a topical cream that you're gonna be using for 7 days. That should be enough. Okay, I'm gonna put the instructions that is gonna be worn at night before going to bed, and it has to be with completely clean face. Okay. Let me just take this off here. You don't need it anymore. Now, special care after this. Please don't wear any makeup or any creams, topical creams in your face, your whole face, for 72 hours, okay, which is 3 days. We want your skin to feel free of any products for that amount of time. The only product that you're going to be having is the topical cream that I'm prescribing you. And with this, you're going to be healing in less than a week, even less of that. So just follow the instructions to the letter and you will be fine. As for this reaction that your body had, it's very improbable that it's going to happen again. As I was telling you, it's one almost in a million that this happened, but it happened to you. Since this is the product that you have been using for your whole life, there is no problem to use it again. Just wait until your skin is completely healed, the areas, and you should be fine. Do you have any questions? Well, it was a complete pleasure. Please, if you have any questions in the future or you have any doubts, don't feel free to call us and we will help you with that. Okay? Very well. Thank you so much and please take care. Goodbye. Hello. Are you ready for your treatment today? And how are you doing? You missed your last week's session, I remember. Oh, really? I hope that you feel better this time. Well, you're here today for the facial swelling treatment. Have you been feeling a little bit puffy lately? Yeah, during the mornings. Yeah, that's mostly the times where we start getting puffy through the night. So let me just finish putting on my gloves and I'm gonna be checking your beautiful face. At the moment, how are you feeling regarding the swelling in your face? More so? Okay. Have you had any changes in your diet? Maybe your salt intake has increased. You're eating something different, maybe more fries or fried food that can contribute to more salt intake into our bodies. Yeah, sometimes we don't even notice that we are taking more salt than we really require because it's hidden among the foods that we tend to eat. So we have to keep in check that, especially when we reach certain ages, we start feeling more and more puffy. And not only in our faces, could be on our hands, our fingers, legs especially could be very troublesome. So very important to check that, okay? Very well. So, okay, trying to do the pressing test to feel how is the water retention in your face. Okay, you're telling me that right now you don't feel the puffiness, right? Well, let me tell you, I'm pressing and it does feel a little bit puffy. But since you're telling me that it's normally during the day, in the mornings that this occur, yeah, through the day we start flushing out the salt. So by midday we start feeling like normal again and we start eating again the salts. Yeah, it does feel puffy, especially under your eyes, right here and on this area. So we're going to be doing the lotion treatment along with the pressure one. We're going to be using this tool right here. It's pretty cool, which is great for the puffiness. We can also work it at home with just a spoon that is being chilled in the fridge. It works great, but we use this. It's softer and the rounder corners feels better in the skin. So I'm going to be using this jade stone, specially designed for the face, the contouring. And we are also gonna be using this serum. This is a moisturizer pearl eye serum for under your eyes, which is gonna be great for the puffiness in the area in particular. And for the rest of your face, I'm gonna be using this sea oil serum that works amazing to reduce the amount of water that is stuck in the area. So we're just gonna be flushing it down. Okay, it works amazing and feels just as great. Okay, so I'm gonna start by cleaning your face as always. Very important to have a very clean face. And put in this to prevent the hair from falling down. Okay. Just putting your hair to the back like that. Good. Very well. Let me start by doing a cleanse. Well, it depends on your diet. You have to well, not keep a journal, but be mindful of what you're eating and try to find what is the cause of this puffiness. What changed in the past weeks that started getting you puffy and all this swelling and water retention. It's definitely something to do with what you eat. And if after you are looking at what you are eating and you're not finding anything of concern, I will really suggest you to go to your medical practitioner for an examination, because there could be an underlying condition causing this. But most of the time is because what we are eating. Okay. Yeah, I tend to get pretty puffy too, especially because of how I eat. My favorite foods are Mexican food, of course, and it can be very salty. So I take water pills. It works great when I take in a lot of salt, depending on the foods. So I know that I'm going to be feeling very swollen on my body and my face. And I just take a couple of pills, of water pills. It makes me feel better. But for our face, there's another way of treating it. It has to be with cold and massages. We cannot be dependent on water pills all the time. Yeah, no, it's not good for your health. Okay. So I'm gonna be starting first with your under eyes. Just put the light better. It's gonna feel cold, okay? Just so you know. Okay, you ready? Here we go. There we go. Might feel a bit oily, that is normal. Good. Now this side. Good. Start the first massage in the area. Okay. You're doing great. Yeah, it does feel good with how cold it is, right? You're doing great. Apply a bit more under both eyes. There we go. I'm going to be applying cold compresses too under your eyes to accelerate the process. Oh yeah, believe me, it feels absolutely great. There we go. There we go. Now let's go with the compress. Now these ones are a bit colder than the jade stone, so please be aware of it. Just remove the excess. Okay, just be prepared that it's gonna be colder than the stone, okay? Very good. First line here, like so. And I'm gonna be using a UV light to speed up the process too. It reacts to it. Good. Excellent. If it feels uncomfortable, let me know, okay? You're good? Okay. Let's remove it. Hello there. Very well. We're gonna finish your eyes with this aloe vera syrup. Amazing for the eyes. It also helps with the bags that we tend to have here, so it just works great, some wonders on it. Oh yeah, and it helps that the aroma is amazing. I'm gonna apply it with a brush since it's easier this way. Okay, looking up for me. Good. Good. Now this side. Good. Excellent. It might feel a little bit itchy, but it shouldn't be uncomfortable, okay? Now, let's work with the rest of your face with the massage. Now, the serum is oily. It's gonna feel very, very slippery. Now you can see how slippery it is. Just put it all around my gloves here. There we go. There we go, excellent. Now I'm gonna be applying a little bit more of pressure into the area, like so. You're doing great. Now you see how I'm pressuring to the outside to release the water. It's puffy in our face. Now here too, this is the area where the water retention is greater. I know it can be uncomfortable with how oily the skin is, so I'm going to be cleaning it too. Very well. Okay, how does it feel under your eyes? You didn't get any itchy? Okay, just remove that, okay? Okay, I'm gonna ask you to look up for me. Up, good. Gentle stippling here. Stipple, 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 stipple. Looking up. Stipple, 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 stipple. There we go. Okay, I'm gonna add a refreshing syrup on you. Just gonna ask you to close your eyes. Yeah, cover them a little bit. Feels great, doesn't it? And this last one, again, I'm gonna close your eyes. There we go. a little bit damp. Let's just take it out. Now this start working the moment we start the massage early on. So in about half an hour to an hour, you're not gonna feel puffy at all. It's gonna feel just smooth and like regular. Let me just take this out. There we go. Okay, so that will be all for your treatment. Do you have any questions? Okay, well, as I was telling you, at home, when you're feeling or you look puffy in the eyes and you notice the swelling especially, what you can do is take a spoon, regular spoon, teaspoon, and put it in the fridge for about, I would say 2 minutes, or into a bowl of cold water. And what you're gonna be doing is, let's say this is a spoon, pressing it into the areas that are swollen in your face, especially the eyes. Very gently, not pressing too much, just barely touching. And after a few minutes, it's gonna start going down, the swelling. Well, it was a pleasure working with you again. I don't know if we have another appointment for next week, but in any case, I'm gonna be contacting you for it. Okay, very well. Well, please take into consideration what I was telling you about your diet, and if you don't find anything unusual, please go with your doctor. Of course. Well, take care, and I will see you next week.